Welcome back to our channel, Libra Aesthetics and Wellness. I'm Dr. Aisha Thomas, MD, the Medical Director.
Hello, I'm Lisa Parker, nurse practitioner.
And today's topic is healthy sexuality. So if you want to hear more about this interesting topic today, then just keep watching. So this topic was by special request. So yeah, we figured it's a great one to add to our repertoire here. You can look for our playlist down below for a list of all the other topics we've covered. And of course, down below you'll find in the description bar our website, Instagram, Facebook, and our number, social media, and how to contact us. So let's get into the topic.
Let's do it.
So what is really sexuality? I'll go to the WHO for their definition. They say that it's a state of physical, emotional, mental, and social well-being in relation to sexuality. So you can see it ties in all the components of a human's existence. And it should be a positive relationship where there's no discrimination, coercion, or violence. So it really doesn't matter who it's with. It just has to not be something that's harmful to them or you or to anyone else. Okay.
Right.
So let's talk about, the different factors that can impact our sexuality. There are quite a few studies that have shown healthy sexuality is important for many reasons. I'll start with number one. It can actually extend your life. It can cause increased longevity. Yeah, there was a study on men, and it showed that men who had sex once a month versus men who had sex twice a week, half of them died earlier. So I guess the more often, the better. Yeah, so it can actually impact on your life. Another positive thing for having, a healthy sexual life is that it could improve your immunity. Yeah, other studies have shown that they did it in younger adults that time, and they found increased IgA in saliva. And IgA is a type of immunoglobulin. I think of it like a bullet. It's shot by certain soldier cells in your body. So you have higher bullets or immunity in persons who have more sexual activity. So that's interesting too. It also can be linked to decreasing your blood pressure, which is very interesting. But think about it. It could be exercise. So that could be how it is. It depends. It can be relaxing or it can be vigorous, depending on how you go about it. It can improve your heart health. It can improve pain. And I feel like, along the way, God or people who believe in evolution or whatever, but I think God created it as a form of anesthesia in some way, because it does certain things in your brain, certain neurotransmitters that are released at certain times during the sexual activity. So that's really interesting. Also, it can improve your sleep as well. So it's something that can be like a natural sort of antidepressant. So I feel that's all positive stuff. So let's talk about ways or things that can affect your sexuality now. We talked about how your sexuality can improve things. What are the things that can affect sexuality for human beings? One of it is inflammation. And these things can, impact it in a negative way. Here at Libra, we talk about this all the time, how inflammation is almost like a root cause of many diseases. So inflammation can cause different things. For example, along the cells in your reproductive organs, like in males, nitric oxide is released. It's something that helps with the veins to dilate and hold the blood and get enlarged. And when that's not released, you will have a problem in the plumbing there. So that's one way inflammation could be a factor. Another thing is, all of these are factors, I think, of heart health. I feel like, the sexual organs are organs just like any other organ.
Right.
And healthy organs perform better. And what are the things that can impact organs and make them unhealthy? Things like diabetes, things like elevated blood pressure, elevated cholesterol. And all of these are part of the metabolic syndrome. So when that happens, you'll find any organ will not function well. So that's meaning in men, they might have issues with erectile dysfunction, which we'll get into a little later. And of course, in women, you'll have different things, arousal disorder, things with problems of lubrication, and other issues like that. Other things that can affect sexuality could be surgery, because, especially if you had surgery on your pelvic organs. You might find men have had prostate surgery, because the prostate is a huge part of men's sexuality, then you'll find that they might have issues with sexuality at that point. Stress. We talk about stress a lot here. Stress will certainly affect, because if you're stressed out, I'll tell you what, with flight or fight, you are not thinking about sex. No. I'll tell you what, you're thinking about survival, you're thinking about just getting through the next day, and it really becomes last on your list. And you might find that happens in busy relationships all the time.
Right.
Yeah. So that's one of the things that we have to, focus on. Now, sleep. That's another thing. Sleep. I mean, I realize that everything is like a whole package. Every organ system, everything's affected by each other. And with sleep, studies have shown decreased sleep, also it will decrease your sex hormones, because remember, hormones are produced at night. So while you sleep, you regenerate. And when that doesn't happen, then you'll find, you may not, your sex hormones are down. You may not be able to have arousal. You may not be able to have climax. You may not be able to just perform well in that regard. So other things that affect sexuality: exercise. Simple. First of all, decreased exercise means you will not, your health is affected on a general level. You might gain weight, your organs overall become a bit unhealthy. And on the plus side, when you exercise, it does a couple of things. Well, it keeps you flexible. You can perform better in that regard. Increased exercise will help with atherosclerosis, that when your blood vessels become clogged up, it will help with that. Increased exercise will also help you to look better physically. You look good. You're like, listen, I'm going out. I'm going to get me a date. You're going to...
Stamina.
Yeah. Hey, all of that is part of it too. So that's it. Mood. That's big. I mean, mood. Because you know what we're like? We're always saying we're not in the mood. Because...
That's true. Yeah. Because of lack of sleep or lack of exercise.
Or it just could be the partner.
It could be.
You know what I'm saying? But, with mood now.
Stress.
Yes. Because all of these are the same thing with the neurotransmitters. Because, you find what, in a good, healthy sexual relationship, you actually have a bonding hormone that's released during climax, oxytocin.
Oxytocin.
That's the same hormone that is released with mothers to children.
Right.
So you find partners will bond during those times. So healthy sexuality also includes having... a lot of times, and people do different things. People have different partners, but a lot of people like to have the long-term partner, and so healthy sexuality, they bond
really
longer.
Builds that bond.
It does. So that's part of it too.
Right.
And of course, hormones. Can you talk about hormones? So we already know testosterone. We talked about healthy hormones here before on this channel.
Right.
And testosterone is it's important for things like your libido, of course. It's important things for things like just general things, your bones. It's important for things like vasodilation. So these hormones, remember those little messengers that go around your body? Very, very important for healthy sexuality. And of course in women, that's your estrogen. And having a good, healthy estrogen, it also helps to build your sex organs, because when your estrogen is low, you go through menopause, what happens? The vaginal cells may become sort of atrophied, thin. You don't have lubrication.
Right.
So you need the hormones for many reasons. And medications. Medications affect us so much.
They do.
That's why Lisa's going to talk about the supplements in a while, and then we're going to a little bit about regenerative medicine, because that's kind of what our passion is here. Like, sometimes the medications themselves, the side effects can be harmful, because think about it. You take antidepressants. It affects your sex drive, because I'll tell you what, it's definitely going to go down. And then you have a vicious cycle, and certain other medicines, they're known to have those issues. So we always like to go free. Free is what?
Free is the best.
Another thing, alcohol and drugs.
Right.
Alcohol is an anesthetic, first of all. It's also a downer. So you'll find that you may not be able to perform. Although people drink, before they go out, you're on a date, you're like, let's drink, and this and that, and then, well, maybe you'll fall asleep, or maybe something will fall asleep, one of your organs right there, and it won't be able to perform. You might have that issue. So I'll let Lisa go a little bit into how hormones and how, natural supplements and your thing. And then I'll go back a little bit into regenerative medicine, so we can talk then.
Oh, that sounds great. So here at Libra, we do have a couple of peptides available for you, and we do have one to help promote healthy sexuality, and that is I knew I was going to mess this up. It's PT141 is what I refer to it as. It's bremelanotide. And basically it's developed from a peptide hormone, melanotan 2. It's for aphrodisiac effects. It actually helps, it interacts with the hypothalamus, which acts on the level of your brain. It actually helps for a rapid onset of arousal, which is great for men and for women. So as far as the men go, it helps increase the erection for 80% of males who really didn't have a very good response with Cialis or Viagra. So a lot of times they use that for first line with men, although I am gonna talk to you about some natural supplements and herbal supplements that you can use before you try to go with the medication route.
Yeah, because I'll say what? Think about the pathway. What is the Cialis and Viagra trying to do? They're working on nitric oxide, what I told you earlier, a vasodilator. So if you need to have your own amount of nitric oxide, it'll just help it stay around longer. But if you're not producing any, those medications may not be effective. So a peptide will work at the level of your hypothalamus, which is a secretagogue. It'll help you to secrete the hormones that you need on that sort of way.
On that level, right. And for women, it really helps on the sexually gratifying experience by 50%. So at least the the women are also getting an added benefit. It's not always, a lot of times I can tell you doing rounds, when I was in school and things like that, a lot of times I always hear the women, they get a little bit discouraged because there's so many things out there for the men, but this is actually a wonderful thing that can help women that's out there on the market as well. So there is hope for you women. It's not only,
I know, because
a lot of studies that we've come across has been a lot of men.
I know, because listen, the male pill that they've been studying for 30 years?
Right.
I'm here it'll never come out because there's no interest by pharmacological people in putting it out there. Women have just been responsible for birth control when there's actually a scientific way to do it for men. Isn't that something?
It is.
Yeah, it's always a bias.
A little bit. And also you find that, the big farm companies, the medications that they can make for women are just so astronomically expensive. It's not covered by insurance, so the out-of-pocket expense is through the roof. Whereas a lot of these are covered for men, so the expense there is crazy for females as well. So, anyways, that's my little soapbox as far as the big pharma company goes. So, anyways, peptide therapy, it's affordable, it's a secretagogue, so it works naturally in the body. It works on the level of the brain. Both men and women can actually benefit from it, and it's best to get something that's most natural for your body. So. There you go. Take that for you. Also, I have another most natural supplements here. So there are some herbal supplements and there are some some vitamin C. I got some vitamin E, which help with vascular health. I also have ashwagandha and ginseng. When both taken together, it actually has a good synergistic effect on you. That helps stimulate sexual and adrenal functions in your body. So they aid with the cardiovascular system, which is great because that opens up, gets good blood flow. So that's great for men and for women. For men, they have horny goatweed, which keeps your nerves stimulated. So when you're actually being stimulated, it helps kind of keep the feelings go a little bit longer, which is great because when you have high dopamine levels, it really helps produce testosterone, which, we keep that going for a longer amount of time, then you keep the sexual arousal around a lot longer. The maca root, which is actually a root vegetable, it's rich in amino acids, and amino acids actually help increase your libido, which is great because, when you get a little bit older in your age, your libido tends to decrease a little bit. So that with the increase of the testosterone, the increase of libido, then you have a good natural interest. So that is great for both partners. Saw palmetto actually helps reduce the size of the prostate. So that can be helpful for men who are starting to experience that. So we know as men age, the prostate tends to enlarge, so that's just another natural way to help with that. As far as L-arginine goes, I don't know explain that one though, but the way that one works is it helps with blood flow in the arteries. So if that, if you're having issues with any kind of cardiovascular disease or any kind of blocking of the arteries, then that helps actually try to increase the blood flow in that area as well. So there's been a couple of randomized trials that are out there, and actually it has really shown to be a pretty good benefit. It's natural and it's not very expensive, so that is a great supplement to actually use.
It's omegas.
Yeah, I was just about to actually say that. So omegas are great because it reduces inflammation, and it helps reduce the plaque, arterial plaque if there is some there. It lowers triglyceride levels, which is wonderful for your nervous system as well. Niacin regresses heart. Yep, it's a good vasodilator. Rejuvenates blood vessels. Red wine and grapeseed extracts, which are antioxidants, they help prevent the buildup of oxidized cholesterol on the artery walls. They also help inhibit inflammation, so that one's great to use with your omegas as well. Ginkgo increases blood flow through the peripheral arteries as well. And I know we were saying that we really were not trying to use the SSRI, but if you really do have psychogenic erectile dysfunction where you really need help of an SSRI, if you use trazodone and yohimbine, using those together, it actually worked better with those in the studies to help prevent erection that's that can last, because a lot of times with the SSRIs you really have a hard time getting an erection and maintaining one whenever you get one. So if you just add that natural supplement to go along with it, then you're able to keep it a little bit longer. So these are a couple of natural supplements to take along with you to help out with your healthy sexuality. And I'll throw it back to you because I know we were going to talk about some regenerative medicine that we're going to be practicing here in the office as well to help you along the way.
Oh, sure. Thank you, Lise. Thank you, Lise. And the reason I really feel like I feel like this was probably a requested topic is because it does affect people's lives.
It does.
You know, it's part of your life. It's a natural thing. It shouldn't be something like we hide away from. Sexuality is normal. It's something we should try to make it as good as possible. You know, make every part of your life as the best you can make it. Because an unhealthy sexuality affects people in many ways. It affects their libido, their self-esteem. It affects, you know, their desire. In women, they could have painful sexual experiences. They can have arousal disorder, climax disorders, you know, infertility. In men, the big thing, of course, the erectile dysfunction. And with men, I mean, you can't really fake it. Maybe women can fake it a little bit and be like, oh, that was so good. But men, if it's not working, I mean,
it's not working.
It just ain't working.
It's not working.
So for men, it's definitely something that affects their you know, their feeling of machoism, their feeling of, you know, manhood, and knowing that it can extend your life. I feel like it's an important marker of your overall health. You know, whether it is mental, because as WHO said, your sexuality, it should be healthy mentally, physically, emotionally, socially. All of these things should be part of, if you have an issue there, it could affect you in those ways. So in terms of regenerative medicine, there are things that we can offer here and that we continue to study that I feel is very interesting and you know, just a great thing to be able to help people, you know, feel better regarding this. So one of the things is platelet-rich plasma and stem cell therapy. These go hand in hand. Because as we age, your cells become senescent, like we talked about previously. Your cells have a certain number of divisions. As you go through life, the cells divide and divide and divide. The DNA can become affected where the daughter cells are not as healthy. They don't live as long. The cells become, you know, just don't work. They don't work well. And every cell in your body has a function. So in terms of your sexual organs, those cells have a function, and you have those stem cells, which can, when you get PRP, which gives those growth factors to those stem cells, or you can give stem cells directly as shots into the sexual organs for men and women. And you can have a great response, and you can have that bond with your partner. You can feel better about yourself. You can improve so many aspects of your life. So, and it's a natural thing. It's from your own body. You spin your blood. We get that plasma. It's concentrated and injected into the areas that's needed. Whether it's, you know, wherever it's needed to be done in men, women, and you have an excellent result. with that. The studies have been fantastic with that. Another thing that is good in regenerative medicine regarding sexuality is even shockwave therapy. That's a specialized ultrasound. We don't have that here, but it's something, because remember, with inflammation plugging up those small arterioles, like think about men, it's like with erections, it's like maybe like a bathtub being filled with water, right? The artery is bringing the blood in, like when you open the faucet, and the veins drain. So if you close up the vein and you put the blood in through the artery, it swells up. But if you have a problem with the plumbing, either the faucet is just dripping a little bit in there, you're not gonna get anything much,
right?
Or the vein is just not able to vasodilate, you just will not get a strong erection in a male. So think of that. So you're trying to fix the whole plumbing system. So with the shockwave, what it will do, it will sort of help with those arteries or the faucet. Like if it has plaque inside, it'll help open it up so that blood flow is good and better. So you have a greater response. Another thing, of course, is hormone replacement. So a treatment with regenerative medicine, replacing something that's missing, simple. So your testosterone level is down, your estrogen level is down, you're not having those responses like the peptide therapy, things to replace what's missing.
Right.
So that's been beneficial. And we can do it different ways. Long-acting ways, pellets, creams, topicals.
Right.
Not a fan of injectables because it's such a very, varied, up and down response, and that's not physiologic. So that's something to keep in mind. So that has been awesome. That's been really great, fantastic. I'm really pleased we can offer like hormone pellets here in the office.
Yeah, we've had great response.
Yeah, I'm pleased about that too. And everything is done, of course, for your labs. This is medical. We check your labs, we check on you, we check your history, make sure everything's appropriate. Another thing is, I mentioned that nitric oxide, and how can you improve that? So I mentioned the exercise, just doing that will help it. Certain foods, like you mentioned the niacin, foods high in nitrates. Certain meats, certain vegetables are high in nitrates, and these will be something that can help you to boost your nitric oxide levels, because that is what Viagra does anyway, and those other things. It helps to prolong that in males.
Right.
So it works for women. We need to.
It's in the screen cream.
Yeah. Well, there you go. That's another thing. A topical that's very beneficial for women.
The screen cream has 6 different items in it. However, it's very expensive
as well because it's for women. What the heck is going on here?
But it works fantastic.
Okay, well we'll have to see about that.
It didn't get the nickname Scream Cream for nothing. That's
at least
for sure.
You know about this one, so okay, I'll take your word for it. So overall, here's what I'll leave you with. I'll leave you with the free stuff. What is free? Take care of your overall body.
That's right.
Because really, as I said, the sexual organs is just part of your overall, it's an organ like anything else.
It's got vasculature. And let's face it, all of these parts need blood flow in order for them to really work.
So, and conditioning, conditioning. So you want like cardiovascular health, you want the exercise, you want the sleep, you want your mood, it's a balanced lifestyle in all. Regardless of every program we've talked about here, from healthy gut, healthy mind, healthy everything, it's always come down to those things.
You're right.
Yeah, but we do have these modalities that will help you. Please reach out to us if you have any issues with your sexuality. We love to talk about sex here.
We're here to help.
Not a problem. We'll help you, with those issues. As I said, we have several programs in terms of the wellness side and of course the aesthetic side. Fun to play around with those fillers, those, the injectables and the machines we have here for that. And just helping to transform you to have your best life. I feel like life is short. Just try to make it, the best life you can. Right, Lise?
Let's do it.
High five on that. Thanks for joining us today for Wellness Wednesday. And, reach out to us. Leave a question below. Maybe you can leave a topic you want us to cover.
Stop by.
There you go. See you soon.
See you next week.